In this video, we're going to talk to you about how to clean a drip stand. There are two times you might be asked to clean this. One is part of the daily routine clinical clean that should be happening in any clinical bed space. If you're asked to do it under these circumstances, make sure that you speak to whoever's asked you to in the bed space, and be careful when you're wiping down the pieces of equipment, because obviously they will be connected to a patient and fully functioning. We're going to ask you and demonstrate how to do it as part of a discharge clean. The concepts are pretty similar. The first thing you need to do is choose your wipe. So we would normally ask you to do this with the green Clinell wipe. You may, given different clinical circumstances, be asked to do it with the red Clinell Clorox wipes that contain chlorine. If you're asked to do this, you'll also be given advice about what protective equipment you might need to wear in order to protect your clothing and other items. But for today, we're going to use the green Clinell wipe. So, step 1, choose your wipe. We've chosen the green Clinell. Now we're going to go on to step 2, which is to take out a single wipe and fully open it out. It's important to fully open it out so that you'll be able to distribute the cleaning agent evenly across the surface. The first thing we're going to think about is, are there any specific sites of contamination that we can see? Are there any specific dirty parts? If there are, spot clean these first before going on to the other steps. Now, we're currently cleaning the pumps themselves. This is because these are the bits that are frequently touched and therefore probably are going to be contaminated. But also, unlike normal where we clean from clean to dirty, we want to clean these pieces of clinical equipment and be able to take them off onto a clean surface before we clean the rest of the drip stand. The principles, although slightly different in terms of order in this case, are the same. We're using a single wipe per surface part of the pump. We're keeping it flattened out, and where possible, where the surface is flat enough, we're using an S-shaped motion. In those areas that aren't flat and easy to recognise where we've cleaned, we're being systematic, making sure that we know that we're cleaning one side first, then another, to make sure that we're not missing out on any of the key components. Because this piece of equipment is then going to be split into different sections, we're making sure we clean as much of it as we can, but specifically the part that's going to go onto another clean surface, so that we're not moving contamination from one area to another. If you're cleaning things like leads, you really do need to clean all the way along, making sure that you're pulling out some of the spiral lead to make sure that everything gets equal coverage. Now we're in a position where we've cleaned as much of it as we can whilst it's attached. We need to remove it, making sure that we're only placing areas that have been cleaned onto new clean surfaces. You may need to put the objects onto a surface in order to be able to get enough pressure through the wipe in order to be accurately able to clean. But this is a decision based on what object you're cleaning. And now it's fully cleaned, we can put it on a pre-clean trolley, so we're making sure that no contamination of that piece of equipment is occurring. For items that are textured, and especially those that have indents, it's really important to make sure that the entire object is cleaned, and so that we do go inside crevices and other pieces which may harbour dust and debris. As you can see, the back of this object is really quite complicated. Therefore, a standard S-shaped motion is not easy to undertake, but it's important to still make sure that you're applying a thorough cleaning to all of the surface, even if you can't do a standard S shape, and that you're not going back on yourself. So now that we have the drip stand with the equipment removed off it, we need to clean from the very top to the very bottom. This is because the very bottom is where the wheels are and are in contact with the floor and considered to be the most contaminated part of the drip stand. As you get further down the drip stand, you are likely to want to change your wipes more frequently as you're moving towards cleaning a more contaminated area. Try if you can to only clean in one direction and not go back on yourself, so that you're not moving any potential contamination from the uncleaned area to the pre-cleaned area. Once you get towards the wheels, bear in mind you should use a single wipe per wheel, as this is going to be the most contaminated piece of the equipment. Try to make sure that you rotate the wheels so that you can make sure you're exposing all of the possible contaminated surface to the wipe.